adding apple cider vinegar to your diet also help you lose weight? Apple cider vinegar is made in a two-step fermentation process. First, apples are cut or crushed and combined with yeast to convert their sugar into alcohol. Second, bacteria is added to ferment the alcohol into acetic acid. Traditional apple cider vinegar production takes about 1 month, though some manufacturers dramatically accelerate the process so that it takes only a day. Acetic acid is the main active component of apple cider vinegar. Also known as ethanoic acid, it is an organic compound with a sour taste and strong odor. The term acetic comes from acetum, the Latin word for vinegar. About 5 to 6% of apple cider vinegar consists of acetic acid. It also contains water and trace amounts of other acids, such as malic acid. 1 tablespoon, 15 milliliters, of apple cider vinegar contains about 3 calories and virtually no carbs. Acetic acid has various benefits for fat loss. Acetic acid is a short-chain fatty acid that dissolves into acetate and hydrogen in your body. Some animal studies suggest that the acetic acid in apple cider vinegar may promote weight loss in several ways. Lowers blood sugar levels. In one rat study, acetic acid improved the ability of the liver and muscles to take up sugar from the blood. Decreases insulin levels. In the same rat study, acetic acid also reduced the ratio of insulin to glucagon, which might favor fat burning. Improves metabolism. Another study in rats exposed to acetic acid showed an increase in the enzyme AMPK, which boosts fat burning and decreases fat and sugar production in the liver. Reduces fat storage. Treating obese, diabetic rats with acetic acid or acetate protected them from weight gain and increased the expression of genes that reduced belly fat storage and liver fat. Burns fat. A study in mice fed a high-fat diet supplemented with acetic acid found a significant increase in the genes responsible for fat burning, which led to less body fat buildup. Suppresses appetite. Another study suggests acetate may suppress centers in your brain that control appetite, which can lead to reduced food intake. Although the results of animal studies look promising, research is needed in humans to confirm these effects. Apple cider vinegar increases fullness and reduces calorie intake. Apple cider vinegar may promote fullness, which can decrease calorie intake. In one small study in 11 people, those who took vinegar with a high-carb meal had a 55% lower blood sugar response 1 hour after eating. They also ended up consuming 200 to 275 fewer calories for the rest of the day. In addition to its appetite-suppressing effects, apple cider vinegar has also been shown to slow the rate at which food leaves your stomach. In another small study, taking apple cider vinegar with a starchy meal significantly slowed stomach emptying. This led to increased feelings of fullness and lowered blood sugar and insulin levels. However, some people may have a condition that makes this effect harmful. Gastroparesis, or delayed stomach emptying, is a common complication of type 1 diabetes. Timing insulin with food intake becomes problematic because it is difficult to predict how long it will take for blood sugar to rise after a meal. Since apple cider vinegar has been shown to extend the time food stays in your stomach, taking it with meals could worsen gastroparesis. It may help you lose weight and body fat. Results from one human study indicate that apple cider vinegar has impressive effects on weight and body fat. In this 12-week study, 144 obese Japanese adults consumed either 1 tablespoon, 15 milliliters, of vinegar, 2 tablespoons, 30 milliliters, of vinegar, or a placebo drink every day. They were told to restrict their alcohol intake but otherwise continue their usual diet and activity throughout the study. Those who consumed 1 tablespoon, 15 milliliters, of vinegar per day had, on average, the following benefits. Weight loss, 2.6 pounds, 1.2 kilograms. Decrease in body fat percentage, 0.7%. Decrease in waist circumference, 0.5 in 1.4 centimeters. Decrease in triglycerides, 26%. This is what changed in those consuming 2 tablespoons, 30 milliliters, of vinegar per day. Weight loss, 3.7 pounds, 1.7 kilograms. Decrease in body fat percentage, 0.9%. Decrease in waist circumference, 0.75 in 1.9 centimeters. Decrease in triglycerides, 26%. The placebo group actually gained 0.9 pounds, 0.4 kgs, and their waist circumference slightly increased. According to this study, adding 1 or 2 tablespoons of apple cider vinegar to your diet can help you lose weight. It can also reduce your body fat percentage, make you lose belly fat, and decrease your blood triglycerides. This is one of a few human studies that have investigated vinegar's effects on weight loss. Although the study was fairly large and the results are encouraging, additional studies are needed. Additionally, one 6-week study in mice fed a high-fat, high-calorie diet found that the high-dose vinegar group gained 10% less fat than the control group and 2% less fat than the low-dose vinegar group. Other health benefits. In addition to promoting weight and fat loss, apple cider vinegar has several other benefits. Lowers blood sugar and insulin. When consumed with a high-carb meal, apple cider vinegar has been shown to significantly lower blood sugar and insulin levels after eating. Improves insulin sensitivity. One study in people with insulin resistance or type 2 diabetes found that adding vinegar at a high-carb meal improved insulin sensitivity by 34%. Lowers fasting blood sugar. In a study in people with type 2 diabetes, those who took apple cider vinegar with a high-protein evening snack had twice the decrease in fasting blood sugar as those who didn't. Improves PCOS symptoms. In a small study of women with polycystic ovary syndrome (PCOS) who took vinegar for 90 to 110 days, 57% resumed ovulation, likely due to improved insulin sensitivity. Decreases cholesterol levels. Studies in diabetic and normal rats and mice found that apple cider vinegar increased good HDL cholesterol. It also reduced bad LDL cholesterol and triglycerides. Lowers blood pressure. Animal studies suggest that vinegar may decrease blood pressure by inhibiting the enzyme responsible for constricting blood vessels. Kills harmful bacteria and viruses. Vinegar fights bacteria that can cause food poisoning, including E. coli. In one study, vinegar reduced numbers of certain bacteria by 90% and some viruses by 95%. How to add it to your diet? There are a few ways to include apple cider vinegar in your diet. An easy method is to use it with olive oil as a salad dressing. It proves particularly tasty with leafy greens, cucumbers and tomatoes. It can also be used for pickling vegetables, or you can simply mix it into water and drink it. The amount of apple cider vinegar used for weight loss is 1 to 2 tablespoons 15 to 30 milliliters per day, mixed with water. It is best to spread this out into 2 to 3 doses throughout the day, and it may be best to drink it before meals. Taking more than this isn't recommended because of potentially harmful effects at higher dosages, such as drug interactions or the erosion of tooth enamel. It's also best to start off with 1 teaspoon 5 milliliters to see how you tolerate it. Do not take more than 1 tablespoon 15 milliliters at a time, because taking too much at one sitting may cause nausea. It's important to mix it with water, as undiluted vinegar may burn the inside of your mouth and esophagus. Although taking apple cider vinegar in tablet form may seem beneficial, it comes with potentially large risks. In one instance, a woman suffered throat burns after an apple cider vinegar tablet became lodged in her esophagus. Side effects of too much apple cider vinegar. Unfortunately, apple cider vinegar has been reported to cause some side effects. This is particularly true in large doses. Although small amounts are generally fine and healthy, taking too much can be harmful and even dangerous. 1. Delayed stomach emptying. Apple cider vinegar helps prevent blood sugar spikes by reducing the rate at which food leaves the stomach and enters the lower digestive tract. This slows down its absorption into the bloodstream. However, this effect may worsen symptoms of gastroparesis, a common condition in people with type 1 diabetes. In gastroparesis, the nerves in the stomach don't work properly, so food stays in the stomach too long and is not emptied at a normal rate. Symptoms of gastroparesis include heartburn, bloating and nausea. For type 1 diabetics who have gastroparesis, timing insulin with meals is very challenging because it's hard to predict how long it will take food to be digested and absorbed. One controlled study looked at 10 patients with type 1 diabetes and gastroparesis. Drinking water with 2 tablespoons 30 milliliters of apple cider vinegar significantly increased the amount of time that food stayed in the stomach compared to drinking plain water. 2. Digestive side effects. Apple cider vinegar may cause unpleasant digestive symptoms in some people. Human and animal studies have found that apple cider vinegar and acetic acid may decrease appetite and promote feelings of fullness, leading to a natural reduction in calorie intake. However, one controlled study suggests that in some cases, appetite and food intake may decrease due to indigestion. The people who consumed a drink containing 25 grams (0.88 ounces) of apple cider vinegar reported less appetite but also significantly greater feelings of nausea, especially when the vinegar was part of an unpleasant-tasting drink. 3. Low potassium levels and bone loss. There are no controlled studies on apple cider vinegar's effects on blood potassium levels and bone health at this time. However, there is one case report of low blood potassium and bone loss that was attributed to large doses of apple cider vinegar taken over a long period of time. A 28-year-old woman consumed 8 ounces 250 milliliters of apple cider vinegar diluted in water on a daily basis for 6 years. She was admitted to the hospital with low potassium levels and other abnormalities in blood chemistry. What's more, the woman was diagnosed with osteoporosis, a condition of brittle bones that is rarely seen in young people. Doctors who treated the woman believe the large daily doses of apple cider vinegar led to minerals being leached from her bones to buffer the acidity of her blood. They also noted that high acid levels can reduce the formation of new bone. Of course, the amount of apple cider vinegar in this case was much more than most people would consume in a single day, plus, she did this every day for many years. 4. Erosion of tooth enamel. Acidic foods and beverages have been shown to damage tooth enamel. Soft drinks and fruit juices have been more widely studied, but some research shows the acetic acid in vinegar may also damage tooth enamel. In one lab study, enamel from wisdom teeth was immersed in different vinegars with pH levels ranging from 2.7 to 3.95. The vinegars led to a 1 to 20% loss of minerals from the teeth after 4 hours. Importantly, this study was done in a lab and not in the mouth, where saliva helps buffer acidity. Nevertheless, there's some evidence that large amounts of vinegar may cause dental erosion. A case study also concluded that a 15-year-old girl's severe dental decay was caused by consuming 1 cup 237 milliliters of undiluted apple cider vinegar per day as a weight loss aid. 5. Throat burns. Apple cider vinegar has the potential to cause esophageal throat burns. A review of harmful liquids accidentally swallowed by children found acetic acid from vinegar was the most common acid that caused throat burns. Researchers recommended vinegar be considered a potent caustic substance and kept in child-proof containers. There are no published cases of throat burns from apple cider vinegar itself. However, one case report found that an apple cider vinegar tablet caused burns after becoming lodged in a woman's throat. The woman said she experienced pain and difficulty swallowing for 6 months after the incident. 6. Skin burns. Due to its strongly acidic nature, apple cider vinegar may also cause burns when applied to the skin. In one case, a 14-year-old girl developed erosions on her nose after applying several drops of apple cider vinegar to remove 2 moles, based on a protocol sheet seen on the internet. In another, a 6-year-old boy with multiple health problems developed leg burns after his mother treated his leg infection with apple cider vinegar. There are also several anecdotal reports online of burns caused by applying apple cider vinegar to the skin. 7. Drug interactions. A few medications may interact with apple cider vinegar. Diabetes medication. People who take insulin or insulin-stimulating medications and vinegar may experience dangerously low blood sugar or potassium levels. Digoxin, lanoxin. This medication lowers your blood potassium levels. Taking it in combination with apple cider vinegar could lower potassium too much. Certain diuretic drugs. Some diuretic medications cause the body to excrete potassium. To prevent potassium levels from dropping too low, these drugs shouldn't be consumed with large amounts of vinegar. How to consume apple cider vinegar safely. Most people can safely consume reasonable amounts of apple cider vinegar by following these general guidelines. Limit your intake. Start with a smaller amount and gradually work up to a maximum of 2 tablespoons, 30 milliliters, per day, depending on your personal tolerance. Minimize your tooth exposure to acetic acid. Try diluting the vinegar in water and drinking it through a straw. Rinse your mouth. Rinse with water after taking it. To prevent further enamel damage, wait at least 30 minutes before brushing your teeth. Consider avoiding it if you have gastroparesis. Avoid apple cider vinegar or limit the amount to 1 teaspoon, 5 milliliters, in water or salad dressing. Be aware of allergies. Allergies to apple cider vinegar are rare, but stop taking it immediately if you experience an allergic reaction. Bottom line. To consume apple cider vinegar safely, limit your daily intake, dilute it and avoid it if you have certain conditions. Take-home message. Apple cider vinegar can provide several health benefits. However, to stay safe and prevent side effects, it's important to monitor the amount you consume and be careful with how you take it. While a small amount of vinegar is good, more isn't better and may even be harmful. If you like a video, then press the subscribe button to notify every time. Thanks for watching.